Hi, I'm Dr. Mike Blaney with Live Healthy MD. Today we're going to talk about surgical revisions after weight loss surgery. Reoperation after weight loss surgery is occasionally required. We consider these operations revisions when we do not change to another operation. We consider the operation a conversion when we change from one type of bariatric operation to a different operation. The most common reason we might perform a reoperation after weight loss surgery, unfortunately, is weight regain. However, occasionally there may be complications or other side effects from the previously performed operation that might necessitate performing an additional procedure. The types of procedures that can be converted to another procedure is the gastric bypass to a duodenal switch, a gastric sleeve to a gastric bypass, and a gastric band can be converted to a gastric bypass, gastric sleeve, or a duodenal switch. In some cases, the gastric bypass may also need to be revised to alter the pouch or the anastomosis. The most commonly converted procedure is the gastric band. The reason being is poor weight loss as a result of that procedure. Another reason for band revision is band slippage. The gastric band can also be easily removed and converted to a gastric bypass, gastric sleeve, or duodenal switch. The sleeve gastrectomy can also be revised or converted to another operation. The reasons a sleeve may need reoperation is weight regain and reflux. If weight regain is a concern, the sleeve can be converted to a bypass or a duodenal switch. If reflux is a concern, we would typically convert the sleeve to a bypass. Occasionally, patients who've had a gastric bypass may have excessive weight regain due to falling back into old habits. For patients who experience this, we typically do not recommend performing a revisional surgery until the patient's behavior has been addressed. Instead, we work with our patients to get them back on track and help them lose the weight that they have regained. We may place them on a medically supervised diet as well as give them the resources to make healthier daily habits. In rare cases, when patients have regained a significant amount of weight after a gastric bypass and are suffering from serious medical problems as a result of this weight regain, we may recommend converting the gastric bypass to a duodenal switch. The duodenal switch is a non-reversible procedure and cannot be converted once performed. Therefore, we consider all other options before suggesting revising a gastric bypass to a duodenal switch. However, if the duodenal switch is performed, patients are likely to experience sustained weight loss as long as the patients remain on track with their eating habits. Lastly, with regards to the gastric balloon, we can always remove the balloon and convert to another procedure that is more invasive yet more sustainable in terms of its weight loss results. The gastric balloon can be removed and converted to a gastric bypass, sleeve gastrectomy, duodenal switch, or gastric band. It should be noted, however, that the balloon cannot be used as an adjunct to other weight loss procedures, meaning we would not recommend placing the gastric balloon in an individual who has previously had a gastric bypass, sleeve gastrectomy, or duodenal switch. And we would not recommend placing the balloon in a patient who currently has a gastric band.